Welcome to AETCM, the emergency medicine channel. Today let us discuss about some of the most common clinical findings in cirrhosis liver. We know that cirrhosis liver means it's a degeneration and regeneration of liver cells due to some reason like alcohol, hepatitis or some other conditions which can produce damage to liver. That part will die. Instead of that part, other parts will regenerate. That parts will become they'll become larger than existing liver tissue. So that degeneration and regeneration of liver tissue will produce irregular liver, and it will be size will be slightly increased during the acute phase of the illness. That means for a longer period, initial longer period, the liver will be enlarged. Later, because of the extensive fibrosis, the liver may shrink. So the shrunken liver will be the ultimate product of this fibrosis. So it is characterized by chronic injury of liver parenchyma, and that leads to regeneration nodules after some times. Again, extensive fibrosis can occur. Later, that will lead to shrunken liver. There are two important types of cirrhosis. One is micronodular cirrhosis. It is characterized by small nodules less than 1 millimeter diameter. It is mainly seen in alcoholic cirrhosis. Macronodular cirrhosis is characterized by large nodules of various sizes. Other diseases other than alcoholic liver disease will produce macronodular cirrhosis. But ultimately, this micronodular or macronodular cirrhosis does not have any major clinical implication in its management. Both type of liver cirrhosis leads to hepatocellular failure. You can see here in liver cirrhosis, one of the important investigation is ultrasound abdomen. In ultrasound abdomen, you can see here normal liver and cirrhotic liver. The liver surface will become uneven and nodular in cirrhosis. In advanced liver cirrhosis, the liver volume will reduce. Liver parenchyma will have coarse echo texture. So these are the important findings. But there is another scan, that is fibroscan. Fibroscan is a type of ultrasound scan that will pick up liver disease much earlier than the regular ultrasound ultrasound scan. So in a patient who is having fatty liver or suspecting an early process of cirrhosis in liver, we can ask for a fibroscan other than a normal ultrasound abdomen and normal ultrasound of the liver. Whatever it is, ultrasound is the easiest method which can detect liver cirrhosis in a patient who is having chronic liver disease. Now, if you see the causes for liver disease, liver cirrhosis, one of the most common cause in our country is alcohol. Then chronic viral hepatitis like hepatitis B or hepatitis C virus. Non-alcoholic fatty liver disease is seen in many conditions like obesity, diabetes, or many drugs, various chronic inflammations. All these things also can lead to non-alcoholic steatohepatitis and fatty liver disease. Autoimmune hepatitis is very common in female patients than male patients. Primary sclerosing cholangitis, primary biliary cirrhosis, secondary biliary cirrhosis, methotrexate, methyl dopa, cryptogenic, that means without any cause. Cardiac cirrhosis, that is long-standing heart failure, congestive heart failure, can lead to liver disease and liver failure. Genetic conditions like hemochromatosis, infiltration of iron into the liver, Wilson disease, copper accumulation in the liver, alpha-1 antitrypsin deficiency, glycogen storage disease, cystic fibrosis. So all these diseases, congenital disease also can produce, genetical disorders also can produce liver cirrhosis. If you see the general feature of liver disease, the patient can have low-grade fever, lethargy, weakness, repeated infection, especially in the abdomen, anorexia, weight loss, upper abdominal discomfort that may be due to splenomegaly. Most of these patients, this discomfort is due to splenomegaly. loss of libido, menstrual irregularities, hemorrhagic tendencies because of the underproduction of coagulation factors. You can see prothrombin time and INR will be elevated in many patients who is having liver disease, because liver is the major organ which can maintain our bleeding, which can produce our bleeding proteins, and that may be defective. That proteins like that type of proteins can be reduced in chronic liver disease, and prothrombin time and INR can be elevated. Patient develops ecchymotic patches all over the body. Patient may develop bleeding tendency. Sometimes platelet disorder also can occur. Platelet can be reduced in conditions where there is chronic liver disease with portal hypertension, because spleen sequestrates large amount of platelets and destroy there. So enlarged spleen itself can produce thrombocytopenia. Jaundice. Mild jaundice is the classical condition what we get in clinical practice, but in a patient who is having severe liver disease, massive jaundice can occur. Parotid enlargement, mainly seen in alcohol liver disease, bilateral parotid enlargement. Diminished body hair is seen in many patients. Fetor hepaticus, a smell of chronic liver disease is classical in many patients. That's a sweet pungent smell. Spider navy, a spider like patch on the chest, mainly it is due to blood vessel abnormalities in liver disease. It's like a spider. When you prick it, the central part of the spider, you can see all the legs of the spider will be disappearing. Clubbing can be seen in some patients. White nails indicates hypoalbuminemia. Palmar erythema can be seen in many patients who is having chronic liver disease. That is due to hormone metabolism alteration, exaggeration of normal speckled mottling of the palm, Dupuytren's contracture, that is thickening and shortening of palmar fascia, that leads to flexion deformities of little and ring fingers. It is thought to be due to fibroblastic proliferation of disorderly coagulation deposits, collagen deposits. It is relatively common in alcohol liver disease. So you can see here, first picture shows parotid enlargement. Bilateral parotid enlargement is very classical. Second picture is spider navy. You can see it is like a spider, and if you press the central part of the spider, all the blood vessels, you can see it is disappearing. Third one is white nails. It is due to hypoalbuminemia. Clubbing is not a classical feature in regular cirrhosis, but patients who is having biliary cirrhosis and chronic liver disease, who is developing hepatopulmonary syndrome, this clubbing is seen. You can see the palmar erythema in the next picture. Hands are red in color. Dupuytren's contraction, you can see here, the last and second last digits are flexed. Now, other major feature of hepatocellular failure is flapping tremor. Flapping tremor is seen in all patients who is having encephalopathy. It can be due to it can be seen in hepatic encephalopathy, uremic encephalopathy, toxic encephalopathy, hypoxic encephalopathy. So all encephalopathies, you can see patients are having asterisk sign or flapping tremors. So here also you can see flapping tremors, that indicates stage 2 hepatic encephalopathy. If you see the stages, stage 1 inversion of sleep rhythm, daytime patient will be sleeping, nighttime he will be awake. Stage 2 onwards he develops asterisks or flapping tremors. Mild confusion is always seen in stage 2. Stage 3 gross disorientation, stage 4 coma. So these are the stages of hepatocellular failure, and that in that hepatocellular failure induced encephalopathy. Now, gynecomastia is another classical feature of chronic liver disease. In female patient, it can lead to breast atrophy. Hypogonadism can be seen in patients who is having chronic liver disease, that may produce testicular atrophy, reduced sexual drive, infertility, impotence, all these things. Now, ascites is one classical finding you get in chronic liver disease. The reason for ascites is, one is the blockage of the internal circulation in the abdomen by this fibrous liver. Second one is portal hypertension due to chronic liver disease. Third is secondary hyperaldosteronism. So that also can produce fluid and water retention. Hypoalbuminemia is another cause for generalized edema, ascites, pedal edema. So all these things add to the problem. Patient develops ascites, fluid in the abdomen. When you are percussing the abdomen, you can get dullness. When you shift the patient right or left, the fluid may shift to opposite side. This is called as shifting dullness. If you tap on one side, other side you can get the vibrations, that is called as fluid thrill. So these are the common signs in cirrhosis. We cannot demonstrate everything in this slide, but whatever it is, patient develops ascites, pedal edema, and sometimes generalized edema. Now, skin pigmentation, many patients who is having liver disease, you can see generalized blackening of skin, but conditions like hemochromatosis, it will be more darker. Cyanosis is a feature of hepatopulmonary syndrome, where the patient develops pulmonary arteriovenous shunting. In that condition, patient can have cyanosis, clubbing and all in chronic liver disease. Liver, when we are palpating the liver, normally in chronic liver disease, you don't get a palpable liver. But in conditions like early alcoholic cirrhosis, you can get an enlarged liver. But in late cirrhosis, whatever may be the condition, liver will be shrunken because of the fibrosis. Portal hypertension is a feature of chronic liver disease. Portal veins are distended, spleen is distended. On palpation, you can get spleen, and patient develops variceal bleeding. There will be increased GI bleeding tendencies in this type of patients. And some patients can have melena also. Black stools can also be seen. On examination, you can see caput medusa. Caput medusa is umbilical vein and its branches will be dilated. So that can be there in many patients. Cruelier Baumgarten murmur, that is a venous hum heard around the epigastrium and umbilical area. That is also indicates portal hypertension. There is a scoring system, child pug classification for chronic cirrhosis, that always indicates the mortality in this type of patients. According to this scoring system, you can see here score 1, 2, 3. According to the scoring system, you can see what is the mortality or morbidity in this type of patients. MELD scoring is model for end-stage liver disease. Another model to predict prognosis in patients with cirrhosis is MELD score. It is based upon bilirubin, creatinine, INR, and etiology of cirrhosis. You can calculate the MELD score like this: 3.78 into serum bilirubin plus 11.2 into INR plus 9.57 and serum creatinine plus 6.43. So if you have bilirubin value, INR value and creatinine value, regular like calculators like med calculators, you can calculate the scoring and you can understand what is the prognosis of these patients. So if score is more than 40, 71% observed mortality, 30 to 39, 52% mortality, 20-29%, 19% mortality, 10 to 19, 6%, less than 9, 1.9 mortality. So mortality predictors are there in chronic liver disease. We can see that there is no need to by heart this type of scores. Everything medical calculators are available in Android phones. You can make use of that. Now, once the patient develops chronic liver disease, there are major complications like patient can have portal hypertension that produces variceal bleeding. Patient develops hematochezia or melena. So, large amount of blood can loss. Acutely, patient can admit in emergency room with acute variceal bleeding, and chronically, patient can have severe anemia and its complications. Patient can have ascites. In that, infection can occur, that is called as spontaneous bacterial peritonitis. It is mostly due to gram-negative organism. So, any patient who are admitted with suspected SBP, we have to start antibiotic, that is third generation cephalosporin. Hepatorenal syndrome, that is a terminal stage of chronic liver disease. Because of chronic liver disease, internal circulations will be compromised, and chronically patient can have reduced circulation to kidneys, and kidneys will go to pre-renal type of renal failure. So in that type of conditions, we have to rule out other causes for renal failure like infections, hypovolemia, Ascites, like that we have to rule out. And once there is no other cause, we can call it as hepatorenal syndrome. That type of hepatorenal syndrome will only reverse with liver transplantation. Hepatic encephalopathy, we have seen it is altered behavior due to toxic materials which bypasses the liver circulation and reaches the brain. Hepatopulmonary syndrome, patient can have dyspnea, hypoxemia, orthodeoxia, and it is due to pulmonary shunting. Malnutrition is mainly due to various abnormalities in absorption of various vitamins, minerals, and it can occur also due to chronic GI bleeding. You know that coagulopathy is a classical feature of hepatic failure because most of the coagulation proteins are produced in the liver. When the liver is failing, you can see coagulation proteins are defective and you can see prolonged prothrombin time and INR. Most of the patients with chronic liver disease, you can see the INR may be 1.5 to 2 or 3. Even then, we don't treat them in emergency room because this is a compensated type of liver disease. Patients are living with this high INR, but there is if there is a bleeding occurs, it will be difficult to stop, and then you will have to treat with fresh frozen plasma, vitamin K, and all. Thrombocytopenia is classically seen due to splenomegaly, portal hypertension. Hematological disorders, like many patients can have splenomegaly, hypersplenism, so spleen is palpable, anemia, thrombocytopenia, neutropenia, that all leads to complications like weakness, dyspnea on exertion, pulmonary edema, bleeding tendencies, infections. Hemolysis can occur in many patients, so they can have megaloblastic anemia. B12 deficiency also can coexist with this type of diseases. Osteopenia, osteoporosis, osteomalacia, all are common in this type of diseases. So we have seen only clinical findings which is seen in chronic liver disease. We didn't go to the treatment of chronic liver disease. Some other class we will be discussing about chronic liver disease management. Liver is a major organ in our body that detoxifies many toxins which is absorbed from the intestine, and it also produces albumin. It also produces coagulation factors. So whenever there is a liver is defective, the most important problem is all these toxic materials bypass liver circulation and directly go to the brain, that produces hepatic encephalopathy. Second thing is ascites and related complication. One of the most common complication of ascites is spontaneous bacterial peritonitis. Most of the time it is due to E. coli other gram-negative organism. So we have to treat the patient with third generation cephalosporins. Then other complication like a patient can have anemia, thrombocytopenia, neutropenia, infections. Then chronic liver disease can sometimes lead to kidney disorder, that is called as hepatorenal syndrome. It can lead to lung disease, that is called as hepatopulmonary syndrome. So when the liver is damaged, it affects almost all organs in our body, all major organs in our body. Even it includes the skin. Skin will become black in color. So whenever we see a patient with liver disease, we should be able to identify this is liver disease, because patients who is having mild chronic liver disease can also have other diseases. So if you are not able to identify that type of diseases from liver disease, we will be missing the diagnosis. Thank you.